So today we'll discuss about diaphragmatic hernias. First we'll discuss a few points on the anatomy, and we'll also discuss about the types of congenital diaphragmatic hernias and their management. Okay, here is an image of the diaphragm. In this image you have to know about the three things. Firstly, you should know about uh, you should know about one tendon. What is the one tendon over here? You see the white central white part? This area is known as the central tendon. And you should know about the two attachments. What are the two attachments? This is the anteriorly, we have sternal attachment, and posteriorly we have the vertebral attachment. Okay, anteriorly sternum and posteriorly vertebral attachment. These are the one tendon and two attachments. Then what about the three orifices? You can see three orifices over here. Wait, let me just clear this out. The three orifices over here. The first one, what is this? This is an orifice for inferior vena cava and right phrenic nerve. And secondly, you have other orifice. This orifice is for esophagus and left and right vagus nerves. And the third orifice, this is for aorta and celiac trunk. Okay, these are the three natural orifices. You have two attachments and one tendon. This is about the anatomy of the diaphragm. So till now we discussed about the normal anatomy of the diaphragm. We discussed about the central tendon. We discussed about the sternal and vertebral attachments, and also we discussed about the three orifices for inferior vena cava, esophagus, and aorta. You can see that the foramen of Morgagni is near the sternal end, right? Over here. So it is also known as the sternocostal foramen, and the foramen of Bogdalik is near the vertebral end. So what is this known as? It is also known as the lumbocostal foramen. You can also see two important muscles over here. These are not a part of the diaphragm. Okay, here you have psoas major, and we have quadratus lumborum. These are the two muscles. Okay, let's discuss about the foramens. Foramen of Morgagni, which is anteromedial. Foramen of Bogdalik, which is posterolateral. From these two foramens, the congenital diaphragmatic hernias originate. Okay, Morgagni and Bogdalik. So Bogdalik hernia is the most common type, and it is in the posterolateral area. Yes, over here we see the Bogdalik hernia, and it is more common on the left side. Okay, and it is embryologically, this is due to the defect in the pleuroperitoneal membrane. Coming to Morgagni, it is due to the defect in the central tendon. We know Morgagni is anteromedial, right? Over here near the sternum, and it is less common. Okay, what do you think are the contents of the Bogdalik hernia, and what are the contents of the Morgagni? See over here. So the structures below the diaphragm, what lies below the diaphragm? On the right side we'll have the liver. On the left side we have the spleen, right? And what else we have here? We have stomach. And also the transverse colon lies here. What is this? A transverse colon. Please excuse my drawing. This is a transverse colon. Okay. So in this Bogdalik hernia, what are the structures close to here? We have the stomach and we have the spleen. So the contents of the Bogdalik hernia will be stomach and spleen. Bogdalik hernia, which is the most common type of diaphragmatic hernia, what are the contents? Stomach and spleen. Then what about the Morgagni's hernia? See the transverse colon over here. One second. The transverse colon. The transverse colon is near to the Morgagni foramen, right? So the most common content of the Morgagni hernia will be transverse colon. Okay, we know about the Bogdalik hernia, we know about the Morgagni hernia, we know the contents. Bogdalik hernia, the contents are stomach and spleen, and Morgagni's hernia, the contents are the transverse colon. Which is the most common hernia? Bogdalik hernia. What is the location? Posterolateral. Most common on the left side. Okay, this is what you should know about the hernias. So, okay, normally what happens? We have the diaphragm, and below the diaphragm we have bowel loops, and above the diaphragm we have lungs. But what happens in congenital diaphragmatic hernia? Because of the gap in the diaphragm, what happens? The bowel loops will come into the thorax. Because of the bowel loops in thorax, what happens? The thoracic organs growth will be hindered. This condition will lead to the decreased growth of the lungs. This condition is known as pulmonary hypoplasia. Because of the pulmonary hypoplasia, the child will have hypoxia, and because of the chronic hypoxia, the child may even develop pulmonary hypertension in the future. So do you think we can identify this pulmonary hypoplasia? We can diagnose this earlier? Yes. In the mother, if the baby has pulmonary hypoplasia, in the baby has congenital diaphragmatic hernia, the mother will have polyhydramnios, and this can be diagnosed by the ultrasound. Mother will have polyhydramnios, and coming to the newborn, um, The newborn will be born with a scaphoid abdomen. Why scaphoid abdomen? Because the abdomen feels empty. Because the abdominal contents like this bowel, which are now in thorax, the abdomen looks scaphoid. What about the thorax? We can hear the bowel sounds in the thorax. Okay, and you can see the in this X-ray, you can see there is a nasogastric tube is passed and it is getting coiled, right? You can see the nasogastric tube can get coiled up. Okay, this is about the diagnosis of the congenital diaphragmatic hernia. And what about the management? See, we discussed because of the pulmonary hypoplasia that the patient would be hypoxic, right? So the patient needs ventilation, but bag and mask ventilation is contraindicated. See, this is a bag and mask ventilation, but it is contraindicated. Why do you think so? Okay, the bag and mask ventilation, why is it contraindicated? Because here, what happens? The air will enter the bowel loops, right? Because and since the bowel loops are in the thorax, what happen? They'll increase in size. Bowel loops increase in size, and this hampers the lung expansion and also aggravates the pre-existing hypoxia. So bag and mask ventilation is contraindicated. So what's the best kind of ventilation in these cases? Which is IPPV, intermittent positive pressure ventilation. What happens if IPPV also fails? We can do ECMO, which is extracorporeal membrane oxygenation. But however, the best treatment would be IPPV. Do you have a definitive management? Yes, the definitive management is surgery, because even though we treat the hypoxia with ventilation, surgery is necessary to repair the defect in the diaphragm. We give a circumferential incision over the diaphragm and reduce the contents and repair the diaphragm with mesh. And after that, we'll place the chest tube. So this is about the management of congenital diaphragmatic hernia. Remember, bag and mask ventilation is always contraindicated in congenital diaphragmatic hernia, and best form of ventilation IPPV. The definitive management would be surgery. Okay.